Okay, so we can start the session now. So yes, am I audible? Is the screen clear so that we can start the session? Okay. So this is the Anatomy MCQ part 10, targeting the NEET PG 2021. Okay, so this is the session, this is the part 10 we are targeting here. Okay, so exactly part 10 we have done, this will be the part 11 part. Okay, yeah. So the session's going on. Yeah. So this is exactly the part 11 today, and we have completed 10 parts. Okay, yes, today is 24th and this is the part 11. So let's start with the session. I think I am audible, and we can start the session now. Yeah. So myself, Dr. Monalisa, and this is the code of mine, Anatin, which can be used by you for accessing free sessions on the Unacademy platform, or for taking discount if you want to take the subscription of Unacademy. So these are all details of my upcoming sessions. Okay, so this is the unlock code and these are the details. The schedule for this month is till 28th of month. I am going to proceed with the 7 p.m. YouTube session, Let's Crack NEET PG sessions, and 9 p.m. is the FMGE session. So this will be the FMGE session where we can have the MCQs of FMGE being discussed, and 6 p.m. session is the conceptual anatomy session, which will be useful for you if you want to study the basic concepts of anatomy. It is extremely useful for the first year MBBS students and those who are targeting the next examination. Now these are the details of Let's Crack NEET PG 2021. So today is 24th, yes, and today is the 11th session. Today is the 11th session. So yes, today is the 11th session, and this is all about the 9 p.m. session. If you want to be the part of these, this is the Let's Crack FMG 2021, and this is 6 p.m. session, that is conceptual anatomy session. So you can join me for this also. Yeah. So yes, now let's start with the first MCQ. So students have joined and we should start with the MCQ first. So all the best to everyone, and today also like the previous session, 10 MCQs will be there. So let's start. So I am going to describe the MCQ along with the basic concepts behind each and every MCQs which I have designed for you today. So question number 1, which of the following structure give rise to clitoris? Which of the following structure is giving rise to clitoris? Whether it is A, mesonephric duct, paramesonephric duct, genital swellings, or genital tubercle. So according to you, which is the correct answer? 4 options are there, and please mark the correct answer. So you will get 30 seconds. I will wait, otherwise I will start with the explanation. Which structure is giving rise to clitoris? Yeah, good evening to everyone. First MCQ. First MCQ. Okay, yes, I got Dev Soni is telling A. Okay, Dev Soni is telling A. What about the others? So whichever you feel is correct, please mark it. Don't worry about right and wrong, because I am here to explain. So please don't get disheartened if it is wrong also. The importance is that I will explain each and every MCQs, and if you have forgotten that fact also, it's for revision. So you can mark whichever you feel it's correct. So yes, I am getting A and B. Okay, Madhu is telling it's genital swelling. Okay, yeah. D, Vishnu, D and D. Okay, so many of the answers are coming up with D. Okay, so many students has joined. Okay, so all the best students, and good evening to everyone, dear. Good evening. So okay, Mullerian duct, which is the correct one? So I will come up with the explanation. Most of you have already done. Okay, so class 12 targeting for MBBS. So yeah, MBBS first year. So yes, you can be the part of these sessions also. So yes, the correct answer is D, that is genital tubercle. So D is absolutely correct. D option is correct. So actually embryological structures, which is always asked in the MCQ, you have to know. So important points which is always asked for male and female genital structures is originating from which embryonic structure. So don't worry. This was the genital tubercle is the correct answer, and let me give you, if you have forgotten also, let me give you the details so that it will be easy for you to revise. So we will have this details. So everyone, those who want to revise, they can just revise it. So one side I am writing embryonic structure. So you can also make this heading like this. Okay, one side we are writing embryonic structure, and the other side you can write male and female. Okay, so male and female, what is it? Adult derivative. I mean to say adult derivative. Okay, adult derivative. So male and female adult derivatives. So yes, it's the adult derivatives. Yeah, now coming with the list. So starting with the list. So the first is, what is asked was genital tubercle. Genital tubercle. So genital tubercle, if we talk about the embryonic structure, in case of males it is giving rise to penis. In case of female it is giving rise to clitoris. Now moving to the next, that is genital swelling. So please write on this list. This list is important. So this list is important for everyone. Those who want to crack their NEET PG entrance exam, they have to know these points, because this is always framed as an MCQ and has been asked in the previous year also. So when we talk about genital swelling, in case of males it is giving rise to scrotum. In case of males it is giving rise to scrotum, and in case of females it is giving rise to labia majora. Okay. Now coming to the third point, urethral fold. So the urethral fold, in case of male it is giving rise to penile urethra, and in case of female it is giving rise to labia minora. Okay, so many students are also giving the answers, very nice. Now the fourth structure which I want to tell you, Mullerian tubercle. So in case of males it is giving rise to seminal colliculus, and in case of female it is giving rise to hymen. The other name of seminal colliculus, can anybody tell me the other name of seminal colliculus? It is also called as verumontanum. It is also called as verumontanum. So please write this enumeration. Very important. It's very, very important for your NEET PG examination. NEET PG FMGE next examination. This list is important. So moving with the further list. So the other one is mesonephric duct. Mesonephric duct. So mesonephric duct, in case of males it is giving rise to duct of epididymis. What is the other name of mesonephric duct? Anyone remembers other name of mesonephric duct? It's giving rise to duct of epididymis. Male structures mainly it is giving rise to, so it is vas deferens, it is giving rise to seminal vesicle, it is giving rise to ejaculatory duct. So the other name is Ulfian duct. So other name is Ulfian duct. In case of females it is giving rise to Gardner's duct. Yes, absolutely right. So many answers are coming from Dev, Soni and Krishna. Great. Now coming to the sixth point, paramesonephric duct. Paramesonephric duct is also called as paramesonephric duct. Okay, paramesonephric duct. So, derivative of paramesonephric duct, it's actually contributing to the formation of female structures. So, in case of males, it is giving rise to appendix of testis. Yes, so many students has given correct answer, Wolffian duct for the mesonephric duct, and para, yeah, I am getting the answers, Mullerian duct, absolutely right. It is giving rise to, in case of males, it is giving rise to appendix of testis, prostatic utricle, and in case of female, so major female structures which is arising is uterine tube, which is also called as fallopian tube. It is giving rise to uterus, it is giving rise to cervix, and it is giving rise to upper part of vagina. It is giving rise to upper part of vagina. So, done with this upper part of vagina. So, yes, these are the structures which we are seeing is arising from the mesonephric duct and paramesonephric duct. So, these are the list. Okay, other than one more point I would like to add on, one more is the urogenital sinus. So, this was till 6, 7 source, please write on this. Urogenital sinus. Urogenital sinus. So, urogenital sinus, in case of males, it is giving rise to urinary bladder, also the parts of urethra, that is the prostatic part, membranous part, and that of penile part. In case of females, it is giving rise to urinary bladder, urethra, and vestibule of vagina. Okay, vestibule of vagina. So, these are important structures. So, just go through it, revise it. Okay. Mukul Chaudhary, how was MBBS, guys? Okay, Mukul Chaudhary, most of the students are already in their completed MBBS or preparing for post MBBS their exam and their competitive exam. So, yes, let's move on to the second MCQ. All of you are ready, students? Yes, very good. So, let's move on to the second MCQ now. So, this is an image based MCQ. So, just take your time and see this image nicely. So, mark the correct answer. So, which of the following is not supplying the marked area of the heart? So, can you see a black arrow? I have introduced this, I have included this black arrow, and I am showing you that area of the heart. So, you have to firstly identify that chamber of the heart, which chamber is it, and then you have to tell me of the following, which of the following artery is not giving blood supply to that area. So, everyone, all the best. So, your time starts now. Mark the correct answer, then I will explain it. Which of the following is not supplying the marked area of the heart? You have to identify that chamber of the heart, and it's very easy to identify that chamber of the heart, and then you have to tell me which of the following artery is not an arterial supply for that area. So, I am getting D as the answer from Kumaran. Okay, Kumaran, what about others? Okay, Kumaran is selling. Okay, ultra can. Okay, diagonal artery, right ventricle. Okay, so let me wait for others and then I can come up with that. So, Acharya is telling it's A, right coronary artery. Okay, Krishna Deka is also telling A. Okay. Shweta is telling A, Madhu is telling A. Okay. So yes, so many A's are coming. Okay, so initially it was D, now A has become the answer. Actually, let me explain. The correct answer is D, diagonal artery only. D, diagonal artery. So the chamber of the heart which is here is the right ventricle. So let me just enlarge it. Firstly, I will tell you about the chambers here which you can see here. Okay, so this is the diagram which I am just highlighting it. So now how you can know? Here this area which you are seeing here, this is the vena cava. This is the vena cava. This is superior vena cava, and lower this will be the part of inferior vena cava. So when we are seeing superior and inferior vena cava, that means this part is the right atrium. This is the right arterial chamber. Now, can anybody tell me which vessel arises from the right ventricle? So, we already know that here we are already knowing this is superior vena cava, this will be lowered inferior vena cava. So, this becomes the right atrium. Now, the arrow is towards the right ventricle, and can anybody tell me right ventricle से कौन सा vessel emerge out होता है? Pulmonary trunk, you must be knowing this pulmonary trunk. Okay, pulmonary trunk, you must be knowing it. Okay. So here let me just highlight this. These are the pulmonary trunk which you are seeing. Okay, and this pulmonary trunk is arising from this part of this whole part of the arrow mark structure. So this whole area will be this whole area which I am highlighting here now. This whole area will be of right ventricle. So let me just use different color for it. Okay, this whole area will be of right ventricle which was marked. So this is right ventricle, no doubt about it. Diagonal artery, it's coming from the left coronary artery, dear. Diagonal artery is coming from left coronary artery. Okay, he is giving answer only. Motivation change your life is absolutely right. You are giving right answer. So this is right ventricle, no doubt. Apex of the heart and all is formed by the left ventricle. So the other part which you are seeing here, this part which will be the left ventricle. So now is it exactly clear the parts? Okay, so see here, this is the left ventricle, and what was asked was this chamber, and this is the right ventricle. So now it is clear, the right ventricle. So you have to know which of the following artery is not giving blood supply to the right ventricle. Is it okay? Now I will reduce this diagram and we can come to this. Pulmonary trunk, yes, absolutely right, Kumaran. Yeah. Now see this. Now my dear friends, right coronary artery is definitely giving blood supply to the right ventricle. It's a major artery giving blood supply to right ventricle through its posterior interventricular artery. Anterior interventricular artery is a branch of left coronary artery, and it is also supplying small portion of right ventricle. Marginal artery arising from the right coronary artery, it is also giving blood supply to the right ventricle. Diagonal artery, which is a branch from that of left coronary artery, it is not giving arterial supply or blood supply to that of right ventricle. So I will write important points for solving this MCQ, then I will show you the diagram also. Please write down important points about the options which was mentioned. So the option which was mentioned was, the A option was right coronary artery. So yes, right coronary artery is definitely providing blood supply to right ventricle. Actually, major part of right ventricle is getting blood supply from right ventricle through its posterior interventricular artery. And posterior interventricular artery is also the determining artery for the dominance. So generally right side of the heart is dominant because of right coronary artery is giving this branch, posterior interventricular artery. Sometimes in 10% cases it can be a branch from left coronary artery. In that case, left dominant heart is there. Okay, the other branch was, one was the LAD artery which was mentioned. What is the full form of LAD artery? Left anterior descending artery. LAD artery is called as left anterior descending artery, and this is the other name for the anterior interventricular artery. What is the other name? It is also called as anterior interventricular artery. Anterior interventricular artery. And it is also providing right ventricle blood supply. Small portion it is giving blood supply of right ventricle. Major part of left ventricle it's supply, but it is also supplying small portion. So this was 2 arteries mentioned. What was the other one? Okay, so the other artery which here itself, if I write it, okay. So see here, when we talk about the marginal artery, yes, it is also giving blood supply to right ventricle. It's a branch from the right coronary artery, ventricular branches, and it also gives. Diagonal artery is a branch of left coronary artery, and it is basically supplying the area of anterolateral part of left ventricle. So what is the area of drainage of this artery? So when we talk about the diagonal artery, it is mainly supplying which part? It is mainly supplying it is giving blood supply to anterolateral part of left ventricle, not the right ventricle. So this is the reason that D option is correct. So got it? Can anybody tell me about the arteries here? So at right coronary artery and left coronary artery is arising from which arteries? Can anybody tell me? I want to show you also this diagram. So let me show you this diagram. Okay. So yes, this is the diagram which I want to show. Here what you can appreciate that here you can appreciate this is the left anterior descending. This is the left anterior descending artery which was mentioned, which was also called as LAD artery, and it is basically supplying the left ventricle at small area of right ventricle also. The right coronary artery, it's descending right marginal. All these branches are supplying which part? These are supplying the right ventricle. So no doubt about this. And the diagonal part of the diagonal branch, which is the branch from left coronary artery, supplying anterolateral part of left ventricle. So yes, I got the answers. Aorta, right coronary from anterior sinus. Okay, yes. So yes, let me just write that detail also. So those who are knowing is absolutely good, and I would like for the others. So please note down. Everyone, this has been asked also several times in the MCQ, that right coronary artery arises from, what is its origin? Right coronary artery from anterior aortic sinus, and left coronary artery from left posterior aortic sinus, from left to posterior aortic sinus, So everyone, is it okay? Can we move on to the third MCQ? We can move to the third MCQ now? Yes. So yes, Kumaran, Sudhakar, yes, many of you have given the answer, good. So let's move on to the third MCQ. Yeah, so this is the third MCQ. Question number 3, which of the given muscle, so let me slightly enlarge if you want, okay, is it okay? Okay, so see the arrow and a small nerve which is pointing. Many nerves are shown here. Here many nerves has been shown in the cranial cavity, so you have to identify the arrow marked nerve and you have to tell me which of the following given muscle is not supplied by the marked nerve in the given section. So it's so you have to mark the correct answer. Arindam Kumar Gupta, very good lecture. Thank you so much, dear. Thank you so much. Yeah, so every time till 28th of this month, 7:30 p.m. I am dedicated for 10 MCQ. So every day you can join me for these sessions. Okay, so 4 more sessions, 25, 26, 27, 4 more sessions for this month. And the updates of my upcoming session for the June month, I will share it in my Telegram group. My Telegram group is Monalisa Anatomy. So you can join that group for anatomy related updates. For my link of session, you can follow me on the Unacademy. for the link of my live free sessions or plus sessions. Okay, yes, so many answers are coming up. So students are giving the answers, and most of them are giving which answer? Most of them are giving B as the answer. So yes, if you are not identifying also the nerve correctly, you can give this answer, because that is easy, because that is not in one category, so it becomes easy. Yeah. So but I will write all the nerves which is shown here, and I will identify it for you. So yes, most of the students have given absolutely right answer. The right answer is B. So most of the students has given right answer, absolutely right. The right answer is B, that is superior oblique. Superior oblique is absolutely right. Yeah, superior oblique is absolutely right, because the nerve here is, so which is the nerve? Can anybody tell me which is the nerve? Arrow marked nerve in this cranial cavity. Yes, superior oblique is supplied by trochlear nerve. So can anybody tell me which is the nerve? The nerve which is the arrow marked nerve in the image. Which is the arrow marked nerve? What is this nerve? Oculomotor nerve. Yes, Sam is absolutely right. Yes, oculomotor nerve. So let move on to this image. This image was given for you. So let me just highlight the important structures. This is again taken from your Grant's dissector, and I would like to identify the structures here in this image. So yes, everyone, so let me just see this important labelings. I will do it for you. So see here, this is the cribriform plate. Can you see? This is the cribriform plate. This part is the cribriform plate. So this nerve is which nerve? This is which nerve? This nerve will be no doubt olfactory nerve. This nerve will be olfactory nerve. This nerve will be olfactory nerve. Now coming to the other nerves. This is the optic nerve. This is the second cranial nerve, optic nerve. This is the first cranial nerve. This is the second cranial nerve. This was the nerve which was asked in the image, and this nerve is oculomotor nerve. What is oculomotor nerve? It's the third cranial nerve. This thick nerve which you are seeing, very thick nerve, that nerve is trigeminal nerve. This is the trigeminal nerve, that means fifth cranial nerve. Trigeminal nerve, which is the fifth cranial nerve. Just close to it, the nerve filament which you are seeing, this one, this is the fourth cranial nerve, and this small one which you are seeing here is the sixth cranial nerve. This is the sixth cranial nerve. Okay, now here you can see the, just move on to the other lateral side. So here you can see this, through this opening, this is the 7th and 8th cranial nerve. These are 7th and 8th cranial nerve. Okay. Now this is jugular foramen. So these nerves are 9th, 10th and 11th cranial nerve, and this is the 12th cranial nerve. This is the 12th cranial nerve. This is the 12th cranial nerve. So everyone, can you see all the 12 cranial nerves has been identified? All the 12 cranial nerves has been identified in this image. Okay. So let me see students. Okay, yeah, oculomotor. So I have highlighted it. Any doubt of the nerves? Other structures also I will mention. So in this image, all the nerves has been highlighted. This stalk-like structure is pituitary stalk. So let's tell you about the other structures. So let me again take this image. So we have already done with the nerves. So here I would like to identify the other structures which is shown here. Okay. Okay. So you can see in a small area, what you can see is the part here. So let me just highlight it with blue color. So this part, okay, this which I am highlighting with blue, this will be the part of sinus. So which sinus is it? Which sinus is the superior sagittal sinus? Okay. Now superior sagittal sinus, no doubt, and all of you are knowing it, This part is the part from the internal carotid artery. This is stalk-like structure which I can highlight with green color. This stalk-like structure which you are seeing is the pituitary stalk. This is pituitary stalk. Okay, this is the pituitary stalk. This is the vertebral artery on either side which will join to form basilar artery, the basilar artery. Now we have got also the, here also we are seeing the part of superior sagittal sinus. Superior sagittal sinus, triple S. Okay. Now we can also see the part of straight sinus. This is the straight sinus. Okay. And this is the transverse and sigmoid sinus. So yes, let me just use a highlighter for it. This part I am telling. So here will be, this is the sigmoid sinus. And this is transverse, TS I have written, transverse sinus. So these are the other structures. So these are the other structures which is shown in the image. Okay, so everyone we have identified. So is it okay everyone? Kumaran, everyone, Sam, Krishna, Shweta, everyone is clear? All the labeling has been done. Anything which you want once more, or is it okay? So I think I have included two diagrams so that so much labeling on one diagram will confuse you. So in this diagram, all the cranial nerves which is shown in this coming out from this cavity, cranial cavity, and the other is the other structure C. So yes, can we move on to the next MCQ, that is MCQ number 4th. Okay, so let's move on to the 4th MCQ, that is again an image based MCQ. Good evening Saruk Ahmed, good evening dear. So let's move on to the next MCQ. Okay, so yes, okay. Question number 4. All of the following statements are true. All of the following statements are true. All of the following statements are true about the structure marked in green in the image. So you have to identify the green colored muscle and you have to tell me which of the following option is incorrect about it. Origin from lateral supracondylar ridge of the intermuscular septum of arm, and insertion is occurring to the stelloid process of radius, causes elbow flexion, and D option is posterior introosseous nerve innervates the muscle. So according to you, which is the incorrect statement about the muscle? So your time starts now. Mark the answer. Mark your answer. Okay, Deka is telling, Krishna Deka is telling it's D. Okay, what about others? Acharya is telling it's D. Shahrukh Ahmed is telling D. Okay, D. So I am getting so many D. Okay, so yes, many D's are coming up. Okay, many. Okay, so deoxydamine, here is the person who has given the answer also. Okay, very nice. He has given the explanation and answer also why the D option is not correct. Which is the muscle also? Please tell me the muscle name also, dear. Absolutely right. So yes, Sam has given the name of the muscle also, and the muscle is brachioradialis, and brachioradialis is supplied by radial nerve, not posterior introosseous nerve. Okay, the extensor muscles which are not supplied directly by the D part, posterior introosseous nerve, in short form we tell it pin nerve. It's the D branch of radial nerve and it supplies all the extensor muscle except two muscle. Which two muscle is not innervated by posterior introosseous nerve, by radial nerve directly of extensor compartment? I think, yeah, it is, yes, you are right, Acharya. And yes, the two muscles are brachioradialis and extensor carpi radialis longus, which is supplied by radial nerve, and the muscle is brachioradialis. Okay, so all other option is absolutely correct. So let's see the brachioradialis diagram now, which will again you can utilize it for revision short. So my dear friends, here humerus bone, you are seeing lower part of the humerus bone. Yeah, this is the lateral supracondylar ridge. So you can see from the lateral supracondylar ridge, the muscle arising is brachioradialis. Okay, great. Your extensor carpi radialis, longus and brachioradialis. It should be longus, Acharya. So you are very near to it. It should be longus, not brevis. Extensor carpi radialis, longus. Okay. Insertion, where is the muscle inserting? Can anybody tell me what is the insertion point of this muscle? Actually, this is the tendon. This part which you are seeing is the tendon of the muscle. Okay, it says tendinous and it is going till the level of. So where it is inserting? Can anybody tell me the insertion point? Yes, Asarya, you are right. Extensor carpi radialis longus. So can anybody tell me the insertion point? Where it is inserting? Insertion is onto the radial stelloid process. Insertion is on radial stelloid process. So yes, in this diagram we can clearly see the muscle is going towards the radial stelloid process. Okay. Absolutely right, Deka. And what about its nerve supply? We have just seen actually two extensor muscles, two extensor compartment muscles which directly receive innervation from radial nerve is ECRL and brachioradialis. Brachioradialis. Okay. It is inserting proximal to radial stelloid. Acharya, actually the insertion point is on the distal most part, distal aspect of the radius bone, close to the radial stelloid process only. Okay, so that is the point. So it's correct. Radial stelloid process is correct. Yeah, just close to radial stelloid process. Yes, you can say proximal, that is correct. Or in other words, you can say distal part of radius, that is close to radial stelloid process, just proximal to it. Yes, if you, yes, Acharya, you can say it like that, just proximal. Or if you tell it's still the level of radial stelloid process also, it's not wrong, it's correct only. Okay. But yes, if you want to pinpoint exact location, so it is just proximal to radial stelloid process. Yes, Acharya. Yes, Acharya, you are right then. Arterial supply is by radial recurrent artery. Arterial supply is by radial recurrent artery. Nerve supply, we have already seen radial nerve. What about the action? So if we talk about action, it is causing flexion of elbow and also supination and pronation. Actually, from the mid-prone position, that is at the radio-ulnar joint till the level of 90 degrees. So it's at the mid-prone position. Yeah, got it. So can we move on to the next MCQ now? So till now we have completed 4 MCQs. So let's move on to the next MCQ. Yeah. So moving on to the next MCQ, question number 5th. Superficial muscle fibers of external oblique muscle arising from middle to lower rib interdigitate with which of the following muscle? Which of the following muscle, whether it is internal oblique, serratus anterior, rectus abdominis or pyramidalis? Yes, yes, in neutral position. Mid-prone position means this. So flexion extension in this neutral position. Yes. Yeah. So done with this. Now let's move on to the question number 5th. So all of you give me the answers. Okay. So deoxydavin is telling serratus anterior. B. Acharya is telling B. Okay, so B. So most of the students are telling it's B, and my dear friends, the correct answer is also B. The correct answer is also B, serratus anterior. So I would like to explain and show you the diagram how it is interdigitating. Actually, when you see external oblique muscle, it is having 8 digitations, 8 fleshy digitations, and each of these digitations are arising Shahrukh Ahmed, yes, it's the okay, superficial fibers, actually internal oblique rectus abdominis and pyramidalis. This can't be the correct answer because rectus abdominis and pyramidalis are vertical muscle lying in the midline. Okay, got Shahrukh Ahmed? And internal oblique, so you are talking about the previous one or what? I am just slightly confused. You was talking about the previous one, Shahrukh, or this one? Okay, I will. So actually it's an important question of superficial muscle. If you will see the external oblique, it will have an interdigitation with two muscle. One is latissimus dorsi and the other is serratus anterior. So this also you can understand. If you will see the diagram, you can understand this. If you see the diagram, you will understand this. And other muscle are like internal oblique and external oblique and transverse abdominis muscle is lying in layers, one above the other, and like this. Rectus abdominis, pyramidalis muscle are the muscle in the midline. So interdigitations you will see by the diagram. So let me show you. So first thing, I want you to know about external oblique muscle so that when I show you the diagram, it becomes easy for you to understand. So write few points about external oblique muscle. External oblique muscle. External oblique muscle arises from 8 fleshy digitations. Sorry, 8 fleshy digitations, each from external surface and inferior border of fifth to 12th ribs. Near where it lies, towards the 5th to 12th ribs, that means lower, in other words you can say lower 8 ribs. So this is about the external oblique muscle origin. Okay, now I want to show that these, as we have seen, 8 fleshy strips are there, 8 fleshy digitations are there, 8 fleshy digitations are there. So it will interdigitate. Okay, it will interdigitate. Okay, so it will interdigitate when you will see. Actually we can categorize this 8 fleshy digitations into 5. Okay, it's 8 fleshy digitations. Okay, so 8 fleshy digitations are we will categorize into 5 and 3. 5 and 3. So when you will see the superior part, okay, when you will see the superior aspect of a 5 digitations which is going down, what you will see, it broadens and it digitates with serratus anterior muscle, and the 3 digitations which will narrow down and it will go towards the latissimus dorsi muscles. This is very clear if once you see the diagram. Okay, I will show you this 5 and 3 digitations ka concept. I will show you on the diagram, then only you will understand. Now this was about origin point. If I want to tell you about the insertion of external oblique muscle, so insertion of external oblique muscle, where it is inserting, if you talk about the insertion point, where it is inserting, so it is inserting into xiphoid process, outer lip of iliac crest, okay, outer lip of iliac crest, pubic crest, also onto the pubic tubercle, also in the linea alba, and going towards anterior superior iliac spine where the inguinal ligament lower down it is going. Okay, this is about origin and that of insertion. Can anybody tell me the nerve supply? Can anybody tell me the nerve supply? Can anybody tell me the nerve supply? Can anybody tell me the nerve supply of external oblique muscle? Nerve supply of external EO, I am writing in short form, it's by T7 to T11 nerves mainly. Okay. Action, if we talk about the action, it is causing flexion of the torso, that is the trunk, and it is causing contralateral rotation of the trunk. Yes, lower 6 T7 to T11, absolutely right, yes. Okay. So now I want to show you this diagram which will help you to understand the digitation parts. Okay, all of you are knowing, but yes, it's flexion, so all of you are knowing the thing, but let me explain on this diagram. So I will see here, this part is the external oblique muscle. So this part which you are seeing, this is the external oblique muscle digitations. These are the external oblique muscles digitations. Okay, this is which muscle? This is the external oblique muscle. So this whole area, let me just okay, this whole area which you are seeing is of external oblique muscle. This whole area which you are seeing is the external oblique muscle. Okay, external aspect. Merging with that of the linea alba, external oblique. Now here what you can see, it is now in this diagram, I am using different color for this. These are the digitations of serratus anterior muscle. So this is which muscle? This is serratus anterior muscle, and here I am using another color. This is latissimus dorsi muscle. Can you see? This is latissimus dorsi muscle. Now if I will show you the digitations where it is joining. So see here, this digitations, upper 5 digitations of external oblique muscle digitating with SA, serratus anterior muscle. Lower 3, my dear friends, this is the lower 3 digitations of external oblique muscle. It is digitation is merging with LD, latissimus dorsi muscle. So have you understood, everyone? Is Shahrukh, have you understood? Shahrukh, have you understood this? And anything you haven't understood, Shahrukh, you can tell me. If it remains also at the end, I will clear it, don't worry. Okay, at the end also I will clear it. You write down and I will go through it, and at the end of the session I will clear it. Okay. So everyone, can we move on to the next MCQ? So I think this is clear, digitations part. Now let's move on to the next MCQ. So before that, I want to show you this cadaveric image. So everyone, please see this cadaveric image. I want to show this image to highlight the direction of these 3 flat muscles which is lying on in the abdomen. So here you can see the direction. So my dear friends, what is the direction of external oblique muscle? Put your hands in your pockets. So just put your hands in your pockets like this. So this is the direction of external oblique. Embrace yourself like this. If you embrace your leg like this, so this is the direction of internal oblique, and if you move more horizontally or transversely, this is the direction of transverse abdominis. See here, here you can nicely see this is the direction of external oblique muscle like this in the lower direction. It is like you are putting your hands in your pockets. So why I am telling it? Because in layers and all cadaveric images, MCQs, you have to understand the muscle fibers of these muscles for identification of these muscles in the MCQ, that is the image based MCQs. Okay, this is the direction of the internal oblique as if you are embracing yourself, and this is exactly going transversely in the transverse direction. The direction of the muscle fibers are transverse. Got it everyone? Can we move on to the next MCQ? Is it clear to everyone? Are you understanding? So yes, now I would like to give a brief about the platform which is giving us the opportunity to interact, okay. The platform which is giving us the opportunity to interact, that is the Unacademy platform. So I would like to tell you about this platform, the benefits of joining this platform. So first thing which I want to highlight here is the iconic subscription. It's the merging of Prep Ladder and the Unacademy group. So where you can have the benefit of watching the recorded versions of Prep Ladder along with the live sessions. So that is the key to success, okay. Now, of the upcoming sessions, boost your preparation by taking 3 months of subscription and get another 1 month absolutely free, okay. And for these all things, you can use my code. So those who want to take the subscription of Unacademy, they can use my code ANAT10 for 10% discount. Now, I would also like to tell you about the foundation batch which is coming up. For the second year professional, it's very helpful. So of the second year students, they can join this course, and again for this they can use my code for 10% discount. For the third year students who want to join the sessions and they want to take the plus subscription, MBBS foundation professional year third batch is going on, okay. So join it, use the code ANAT10 for 10% discount. Now target your preparation, my dear friends, for the next 2022. So those who want to target their preparation, they want to take the plus subscription. Again here I have taken anatomy in the next batch. You can take this subscription, you can be the part of test and analysis batch, and you can use the code, again my code ANAT10 for 10% discount. So you can use this code ANAT10 for 10% discount if you wish to join these sessions. My dear friends, 34,000 MCQs are there on the platform of Unacademy, so do grab it. Download the Unacademy app, find your goal as NEET PG, and therefore you can just go through which of ever subscription you want. You can join it and you can avail the opportunity. Live classes. So what are the benefits of joining Unacademy? Live classes, my dear friends, along with the plus classes, okay. So there is plus classes. So live classes, Unacademy is giving you the opportunity to be the part of free sessions, and that is a very useful part. So those who are not willing to join now, they want to join later, they can just avail the opportunity of free sessions, and all 19 subject free sessions are there. You can just use the code ANAT10 for viewing the free sessions or for taking the subscription. The other point is that if you want to be prepared for your 19 subject in a very structured way, you have to join the plus courses, and for that you have to take the subscription at least for 3 months, 6 months, whichever suits you, or whether 1 month also. You can be the part of weekly test and unlimited access is there. It's not that one time, 2 time, you can view the sessions 100 times if you wish, but there is less time. So that is not possible. So I would tell you, be the part of live sessions and cover it. If any subject is remaining, you have not time for viewing it, you can see it afterwards also. All the best. Now let's come up with the next MCQ for today's session, that is question number 6. Okay students, so let's move on to the question number 6. Which foramen transmit nerve branch to meninges? Which foramen transmit nerve branch to meninges? Okay everyone, this is the question number 6 for you. So do mark the correct answer. Take your time. Which foramen transmit nerve to the meninges? Nerve to the meninges. Most right answer among the option. Whether it is foramen spinosum, mastoid foramen, jugular foramen, or foramen magna. So which is correct? So I got an answer from Akshit Bhatt. He is telling it's A. So Krishna Deka is telling A. Krishna Deka is also telling it's A. Okay. Kumaran 6 is telling A, okay, it's A, okay. What about others? Sam is telling it's C, okay, jugular foramen. Okay dear, what about others? So A and C, I am getting A or C. Sonam Modi is telling A, Deoxy is coming up with the explanation of the answer, so he is making my work easier. Okay, so yes, he is telling middle meningeal nerve through foramen spinosum. What is the name given to that nerve? What is the name given to that nerve? A particular name is there. What is the nerve? Deoxy. Okay, so carry nervous spine. So Akshit Bhatt has also given the answer with writing the name of the nerve, that is nervous spine. Absolutely right everyone. So the correct answer here is A, that is foramen spinosum, and through it what traverses? The nervous spinosum traverses, and it is providing meningeal branch to that of dura mater of middle cranial fossa. Okay, so let's see this foramen, and quickly we see which structures passes through these foramen. Many of you have given the right answer. So yes, so which was the nerve which we have to asked in the MCQ? The nerve, so here we are seeing this is the foramen spinosum lying very close to foramen ovale. Okay, so we can see just close aspect to it is the ovale. Okay, and above its foramen rotundum. We can also see superorbital fissure and optic canal. Okay, optic canal, superorbital fissure, foramen rotundum. So the foramens and the structures passing through each foramen should be known to you. Okay, so you already know optic nerve passes through optic foramen along with okay, you already know this. Superorbital fissure से बहुत सारे structures जाते हैं, LFT, lacrimal, frontal, trochlear, the two division of oculomotor nerve, abducens nerve, nasociliary. Okay, foramen rotundum से maxillary, ME maxillary nerve, emissary vein, foramen ovale से male जाता है. Okay, MALE, male. Okay, you already know. So we have discussed this so many times. So which is asked in this MCQ, I will tell you. So foramen spinosum. So write down which structures pass through foramen spinosum. So I am not, where is Shahrukh? He has told me. Shahrukh, are you understanding? Shahrukh Ahmed, are you understanding? I am going through this options in the, I am going through the options only, don't worry. So one was the option, one option which was the correct answer is foramen spinosum. So through foramen spinosum, the structures passing is MMA. What is MMA? Middle meningeal artery, middle meningeal vein also passes through it, middle meningeal artery, middle meningeal vein, and absolutely right, but meningeal branch of mandibular nerve, meningeal branch of mandibular nerve. Okay, Saruk, thank you. Meningeal branch of mandibular nerve, and a particular name is given to it, that is called as nervous spinosum. That is called as nervous spinosum. Nervous spinosum, and nervous spinosum is supplying the dura mater of middle cranial fossa. It is supplying the dura mater of middle cranial fossa. Got it? Middle cranial fossa. Now let's move on to the other foramen. Okay. So all of you can see the mastoid process. Everyone, can you visualize here? This outline is of mastoid process of temporal bone. Okay, so this is hole which you are seeing, this is the hole, this is the part of temporal bone, as you can see. So this is the mastoid process of temporal bone. What is shown here? MP. What do you mean by MP? Mastoid process of temporal bone. Now my dear friends, can you see a foramen which is shown with a arrow? Everyone, can we visualize this foramen with an arrow? Okay, now that is mastoid foramen. This is showing you the mastoid foramen. This was also asked in the MCQ as one of the option, and the structure which is passing through mastoid foramen is mastoid emissary vein. What structures passes? Mastoid emissary vein passes through it. And mastoid emissary vein is continuing to which venous sinus? Can anybody tell me which sinus? Anybody can tell me the answer? Mastoid emissary vein is continuing with which sinus? It is entering into which sinus? Sigmoid sinus, my dear friends. It is entering into sigmoid sinus. Yes. Now moving to the other branches. So mastoid emissary vein is the one, and the other structure which is traversing through mastoid foramen is small branch of occipital artery. Small branch of occipital artery which is traversing through it. And what is the name of that artery? That artery is posterior meningeal artery to dura mater. Posterior meningeal artery to dura mater. Posterior meningeal artery to dura mater. So is it okay, everyone? So we have done with this foramen, that is the mastoid foramen, and we have also seen the structures traversing through it. Now let's move on to the next one. Next option was, okay, so see this diagram. Jugular foramen, my dear friend, one of the foramen which has been asked was the jugular foramen. Jugular foramen was asked. So all of you are knowing, we can clearly see jugular foramen when we see the interior or cranial cavity also, but when we see the basal aspect of the skull, there also we can appreciate the jugular foramen. We can appreciate jugular foramen. See here, this is the jugular foramen which you are seeing. This is the jugular foramen. So structures traverse, actually when you will see from the cranial aspect, it is categorized into 3 parts, and you have to know the structures passing through jugular foramen. Also you can see the part of carotid canal here. This is the carotid canal. Okay. So what structures passes through carotid canal? Can anybody tell me? Structures passing through carotid canal and structure passing through jugular foramen. Structures passing through carotid canal, anybody remembers? It's the internal carotid artery covered by sympathetic plexus, that is called carotid plexus, and through jugular foramen the structures traversing is 9th, 10th, 11th nerve, along with it inferior petrosal sinus and sigmoid sinus, and also meningeal branch of occipital and ascending pharyngeal artery. So do you want me to write it or is it okay? So yes, seen. So I also want to tell you the structures traversing through it. So please write down only. Structures traversing, write down, through jugular foramen, absolutely right, all of you, absolutely right. Structures traversing through jugular foramen is following. The structures traversing is through, it is 9th, 10th and 11th cranial nerve, through intermediate compartment. So anterior compartment is the inferior petrosal sinus, and also sigmoid sinus passes through it, which will continue lower down becoming internal jugular vein, and also the structures traversing is meningeal, okay, meningeal branch of occipital artery, and also branch from the ascending pharyngeal artery, also branch from the meningeal branch from the ascending pharyngeal artery. Okay, so done. I have written this detail. This is the structures traversing through jugular foramen. Okay, Saruk Ahmed, don't worry, in the coming session I will take a session on all the foraminas of the skull, and there I will give you the tricks. Few mnemonics are very easy to know, that is ME, male and like this. So don't worry, we will have a session on this only in the coming month, June month May I will have this. So many foramens are there. Actually this is like MCQ targeted, so I am clearing it with the anatomy also of that particular part, but if you want I will target one session especially on all the foraminas. Okay, many foraminas are there, so I will especially do it for you, don't worry. Carotid canal, now moving to the next is the carotid canal also. So please write down about carotid canal. Carotid canal, the structures traversing is internal carotid artery which is covered by plexus, that is carotid plexus. Okay, what was the other foramen? I think foramen magnum was also mentioned there, foramen magnum. Okay, foramen magnum. So let me show you foramen magnum. This cavity which is shown with the yellow color is the foramen magnum. Here there is one ligament which is traversing here, here will be the ligament, and this ligament is alar ligament. This is alar ligament. Alar ligament is dividing the whole foramen magnum into anterior part and posterior part. So A means anterior compartment of foramen magnum, A means anterior compartment of foramen magnum. And what about P means posterior compartment of foramen magnum. Now why it is important that we should know A and P? Actually anterior compartment is through this structures passing is osteoligamentous, only ligament passes, so it is called as osteoligamentous compartment. And when we are talking about posterior compartment, the structures traversing is neurovascular, so neurovascular structures are traversing through it. So yes, write down the structures passing through anterior and posterior compartment of foramen magnum. Write down. Heading, write down foramen magnum. This was the options given in the MCQ, so I am detailing this. The structures traversing through anterior compartment. Structures traversing through anterior compartment are following. The structures traversing through anterior compartment are, three structures are there. Apical ligament, membrana tectoria. What is the other one? The membrana tectoria. Membrana tectoria. And moving to the third structure is the cruciform ligament upper part. Cruciform ligament upper band. Got it? Now coming to the posterior. So now I would like to tell you about the posterior compartment. My dear friends, posterior compartment is called as neurovascular compartment. Why neurovascular? Only nerves and vessels passes through. Neurovascular compartment is this. What about anterior compartment? Anterior compartment is osteoligamentous compartment. Why osteoligamentous compartment? Because only ligaments passes through it. Okay. So posterior compartment, the structures traversing are, write down, the structures traversing through posterior compartment are following. Please write on the list. The structures are: fourth part of vertebral artery, fourth part of vertebral artery, anterior spinal artery, posterior spinal artery, accessory nerve, 11th cranial nerve, tonsil of cerebellum, and lower part of medulla also. Tonsil of cerebellum, not always, sometimes, and lower part of medulla. Lower part of medulla. So these are the structures traversing. These are the structures which is traversing through foramen magnum. So in short, we have done with this. Can we move on to the next MCQ, everyone? So let's move on to the next MCQ, that is MCQ number 7th. MCQ number 7. So still we have got 3 more MCQs. Okay. So slightly we can increase our pace. Is it okay? Okay. Which of the following is a derivative of Richard's cartilage? So, okay, which of the following is a derivative of Richard's cartilage, students? Which of the following is a derivative of Richard's cartilage? Whether it is A, stapes, whether it is B, malleus, whether it is incus or sphenomandibular ligament. So I am getting answers. Okay, so I am getting Deka is telling it's A, Deka is telling it's A. Okay, Deka, what about others? Sharan Acharya is telling A, Akshit Bhatt is telling it's giving the explanation only. Great. Okay, Kumaran is telling A, Bharat M is telling A. Yeah. So the correct answer is stapes is absolutely correct. All other malleus, incus and sphenomandibular ligament joint, all other is not arising from Richard's scalum. Malleus, incus is from the first cartilage they are arising. So, let me give you the detail about this. If we talk about first arch cartilage, the first arch cartilage is Michel's cartilage, and the structures Michel's cartilage and the structure derived from it are following. The structures are malleus, the structures are incus, the structure is anterior ligament of malleus, the structure is sphenomandibular ligament, the structure is sphenomandibular ligament, anterior ligament of malleus, sphenomandibular ligament, malleus and incus. These are derivatives from the first arch. Now, moving on to the derivatives of second arch. So, yes, I would like to show you this diagram and then I will move up with the explanation. Yeah, see you. So, when we are talking about first arch, when we are talking about the first arch, it's the Michel's cartilage, malleus and incus which is shown. When we are talking about second arch, is the Richter's cartilage and stapes, and of the third arch is the hyoid bone. So, let me give you more detail. It will be enough. I will more detail it, the cartilages of all the arches. So, let me write. So, first arch we have already done. Moving on to the second arch cartilage. Second arch cartilage is, it's called as the Richter's cartilage, and the structure derived from it are stapes, styloid process, stylohyoid ligament, small corona of hyoid bone, superior part of the body of hyoid bone, superior part of the body of hyoid bone. These all things are many times asked in the MCQ, so do have a revision of this. It's very important to know second arch derivatives. These are all list of second arch derivative. Moving on to the third arch. Okay, before that, yeah, third and the fourth, sixth arch. So, write down third arch. Third arch derivatives are greater corona of hyoid bone and lower part of the body of hyoid bone, greater corona and lower part of the body of hyoid bone. Fourth arch and that of sixth arch. So, there is no fourth and sixth arch derivative, there is no fifth arch. The derivatives are, actually in one line you can say all laryngeal cartilages, except epiglottis, So, please note down all laryngeal cartilage except the epiglottis. All laryngeal cartilage means thyroid, cricoid, corniculate, cuneiform, okay, except epiglottis means epiglottis is not derived from it, because epiglottis is derived from caudal part of hypobranchial eminences. Caudal part of hypobranchial eminences. It is derived from caudal part of hypobranchial eminences, from which the posterior most part of the tongue is derived. That part is only giving rise to epiglottis. Epiglottis is leaf-like flap which is lying on the posterior aspect of tongue. Rest all cartilage, whether it is thyroid, whether it is cricoid, whether it is arytenoid, whether it is corniculate, whether it is cuneiform cartilage, all the laryngeal cartilage is derived from fourth and sixth arch. So, done. Can we move on to the next MCQ, that is MCQ number 8th. So let's move on to the 8th number MCQ. Yeah. Which of the following is true about upper 1/3 of the rectum? Which of the following is true about upper 1/3 of the rectum? So please mark it. Is it covered by peritoneum only anteriorly? It is covered by peritoneum on the front and sides of the back. It has no peritoneal attachment. It is covered by peritoneum on the sides and anteriorly. So according to you, which is the correct answer? Question number 8. So yes, we have got still 8-1. I am doing 2 more MCQs. So yes, quickly we will finish the 10 MCQs. So this is a direct question. This is a direct question. I will show you the diagram for it. So yes, answers are coming up for the 8th number. So students, go on, otherwise I will come up with the explanation. Upper 1/3 of the rectum, upper 1/3 of the rectum. Okay, so actually the correct answer is it's D. Nothing to worry if you are not knowing also, I will explain. It's the D. It's covered on sides and anteriorly. So yes, deoxy has given the right answer. See here, you can see in this diagram that when you see the anterior aspect of upper 2/3, it is whole covered by the peritoneum. When you see posteriorly part of the rectum, it is non-peritoneal. So this is quite, can you see the green color structure which is shown? The green color structure is the peritoneum, and posterior part of the upper aspect or whole of the posterior aspect of the rectum is non-peritoneal. Upper aspect also it is non-peritoneal. So see here, this is a schematic diagram where you can appreciate the peritoneum covering, and here you can appreciate in the peritoneum covering that when we talk about the upper aspect, see here, upper 1/3 of the rectum, when we are talking, it is covered by laterally and anteriorly on whole aspect by peritoneum. Okay. Yeah, when we are talking about middle 1/3 of the rectum, when we are talking about middle, it is only covered on anterior aspect by the peritoneum. And when we are talking about the third part here of the lower part of the rectum, you can see it is not covered by any peritoneum. So middle part only anterior aspect by peritoneum as shown in the diagram. Middle part is only anteriorly covered by peritoneum. Upper part is covered by peritoneum on the anterior and lateral aspect. So yes, so this is the reason D answer is correct. So it was a direct MCQ. Let's move on to question number 9. Everyone, so let's move on to question number 9. 2 more MCQs, 9 and 10. So quickly we will solve it, because from 9 PM it's hardly 10 minutes remaining. I have to start next session. So yes, let's start with the 9th number MCQ. Okay, branchial cyst arises due to, option A is failure of obliteration of second branchial cleft, persistence of urachus, thymus or thyroglossal tract. So according to you, which is the correct answer? Branchial cyst arises due to. Yeah, which is the correct answer? Question number 9th. So yes, Deka is telling it's A. Okay, Deka is telling it's A. What about others? Okay, Deoxy is also telling it's A. Acharya is telling it's D, and Dev Soni is telling it's A. It's A. So D and A is coming as an answer. D and A is coming as an answer. What is the correct one? Brachial cyst arises due to, the correct answer here is, my dear friends, the correct answer here is A. Okay, A is the correct answer. Failure of obliteration of second branchial cleft. A is the correct answer, all of you. So please note down, this is actually what happens, the mesenchyme of second pharyngeal arch. So this second pharyngeal arch mesenchyme is growing rapidly over the third, fourth, means it is burying the second, third and fourth cleft. So it is rapidly growing and it rapidly grow and buries under it. It buries the second, third and fourth pharyngeal cleft. So sometimes what happens, the part of it doesn't get reduced. It is there in the form of sinus. It remains. Okay, it doesn't get obliterated. At some times, it is not getting obliterated and it is forming a sinus there. It's forming a sinus there. Okay, so if it fails to obliterate the branchial cyst, sorry, generally what happens, when the second pharyngeal arch is growing over the second, third and fourth pharyngeal cleft, it is totally buried under it and the remnant of this is not seen, but at times it can be appearing as a branchial cyst or branchial. It appears like a branchial cyst because its remnant will appear, it will not fully degenerate, and that is the condition. And it is seen, if you will see, this is a case of branchial swelling which you are seeing. This is a case of branchial cyst or swelling which is shown in the diagram, and it is exactly this muscle is sternocleidomastoid muscle, and more common location it is lying anterior to sternocleidomastoid muscle. So yes, Dr. Kumar, so many of the students has removed their messages. What happened? So see here in this diagram you can clearly see this is the sternocleidomastoid muscle. Okay, this is the sternocleidomastoid muscle and anterior to it the second branchial cleft or cyst. So most commonly the second branchial cyst or cleft is seen. It's very common and it is just anterior to that of sternocleidomastoid muscle. Okay, everyone. So let's move on to the next MCQ, that is the 10th number MCQ. Everyone. Okay. Yeah. Question number 10. Posterior boundary of carotid triangle is bound by which of the following? Which of the following muscle is forming posterior boundary of carotid triangle? Whether it is superior belly of omohyoid, whether it is posterior belly of digastric, sternohyoid or sternocleidomastoid muscle. So according to you, which is the correct answer? Question number 10th, mark the correct answer. Okay, so 10D. So I am getting answers from Kumaran as 10th answer is D. What about others? Sternocleidomastoid, ma'am. Yeah, okay, sure. So, okay. Yeah, most of the students are okay. One is telling B also. No. The correct answer of carotid triangle posterior boundary is sternocleidomastoid muscle. So, in the anterior triangle, we have 4 triangles. We have got digastric triangle, we have got carotid triangle, we have got the mylohyoid triangle here, okay, carotid triangle, muscular triangle. So, we will see the boundaries of carotid triangle now. So, see here the red color triangular space, can you see the outline of red color triangular space? So, here I just want to tell you about the boundaries. So, here sternocleidomastoid muscle is forming the posterior boundary for the carotid triangle, as you can see in the diagram itself. Can you see the omohyoid? So, omohyoid superior belly, to be more specific, it is the superior belly of omohyoid, and it is forming antero-inferior border. 2 other muscles are there, stylohyoid and digastric. These 2 muscles, both stylohyoid and digastric, to be more specific, posterior belly of digastric muscle along with stylohyoid is forming its which boundary? It is forming superior. It is forming superior boundary. So, see here my dear friends, in this diagram we have seen here superior boundary of the carotid triangle is formed by stylohyoid and digastric, posterior boundary by sternocleidomastoid muscle, superior belly of omohyoid is forming antero-inferior boundary of carotid triangle, which is quite evident. I am not going into other triangles because the MCQ was targeting about carotid triangle. So, yes, few points about its other points if you want to note down. So, floor, if we talk about floor of carotid triangle, the floor of carotid triangle is formed by thyrohyoid muscle, hyoglossus muscle middle and inferior constrictor muscle, middle and inferior constrictor muscle, MC and IC. What is it? Middle constrictor muscle, that means, and that of inferior constrictor muscle. So these four muscles are forming the floor. It is also often asked about the roof. Roof is formed by investing layer of deep cervical fascia. Roof is formed by investing layer of deep cervical fascia. And what about the contents, important contents? So yes, let me just write down important contents of the triangle. So important content of carotid triangle. The important content, so I am just writing the important one. The important contents are, it is containing all kind of carotid artery, common carotid artery, external carotid artery, internal carotid artery. It is containing internal jugular vein, it is containing nerves, it is containing 10th vagus, okay. It is also containing the 11th cranial nerve and that of the 12th cranial nerve. It is containing the 11th and that of 12th cranial nerve. It is also containing ansa cervicalis. So it is also containing ansa cervicalis, which is a nerve loop, okay. It is also containing deep cervical lymph nodes. It is also containing cervical part of the sympathetic chain, cervical part of sympathetic chain. So these are the important contents which is lying here. Got it? Sympathetic chain. So yes, I am just concentrating on this carotid triangle only. So let us see this image, and in this image also you can see the triangle here which I am highlighting here, okay, this one. So this triangular space which you are seeing is the carotid triangle, this triangular space which you are seeing, this triangular space is the carotid triangle, okay. So posteriorly by sternocleidomastoid muscle, posteriorly by sternocleidomastoid muscle, superiorly by the two muscle digastric and stylohyoid, and antero-inferiorly by omohyoid superior belly. So that is the same thing which we have seen. So this is all about this. So okay, so just finishing the session. Before finishing the session, I just want to tell you that my upcoming sessions are, the unlock code of mine is my referral code and unlock code is ANAT10. These are the schedules of my upcoming sessions. As you can see here, these are my upcoming session schedules. 7:30 YouTube special class, 9 PM. Conceptual anatomy session also a special class, 6 PM. Referral code is this. These are the details by which you can use this referral code and target taking the subscription of Unacademy and being the part of my free live sessions. So yes, all the best students, all the best. We will meet again tomorrow at the same time. All the best everyone. Thank you. Thank you everyone. Thank you dear. Yeah, thank you so much. I am ending the session. It's already 1. I have